Senator Debbie Stabenow, the U.S. Senator from the great state of Michigan, thanks for making time to be with us. I appreciate it.
Absolutely.
Let me just ask you to have the floor, ma'am, and tell us about the work you're doing in the U.S. Senate and bring us up to speed.
Well, DJ, first of all, I really appreciate the forum and the State of Reform organization for hosting this event and the other events that you've done. You know, I've been involved in some way in healthcare policy my whole career as an adult in a lot of different capacities. And it's my passion broadly. And I have to say that I'm very proud of the incredible leadership coming from Michigan, whether it be on the research front or providing services. And certainly everything that's happened under COVID. I'm so grateful for all of our hospitals and health centers and just everybody I could list that would just step up. One of the things I wanted to just share that I'm very, very focused on now, and actually I've been focused on in some way, I think my whole life, goes to how we provide quality healthcare for healthcare above the neck as well as below the neck. And what I mean is mental health and addiction services, which are so critical. Traditionally in our country, despite the fact that the very last bill that President Kennedy signed, as president before losing his life was in 1963, and it was the Community Mental Health Act. And we have not yet ever completely, realized that vision of quality community care. And so a number of years ago, I reached out, was talking to my partner and friend on community health centers, Senator Roy Blunt from Missouri. We are the bipartisan leaders of community health centers. And with health centers, there is ongoing reimbursement through the healthcare system, through Medicaid and so on, full prospective payment for services, as well as grants. And I was lamenting the fact that why couldn't we do that in behavioral health? Why is it in behavioral health, when the grant runs out, the service stops? So it's start, stop, start, stop. You would never say to somebody who was having a heart attack and needed heart surgery, gosh, this is a real problem, but so sorry, the grant ran out. And we say that in mental health and addiction all the time. So I put together an idea, and Roy was willing to join me in this, which is to create a model for quality community care for behavioral health, just like we do for federally qualified health centers. And we're now in the middle of a movement on this. We set up standards where to be a certified community behavioral health center, you had to provide high quality services, including 24-hour psychiatric emergency services, which is critical in the community. We don't want folks sitting in jail. We want them getting the help that they need. We don't want them sitting in the emergency room. We want them getting the help that they need. And so we began a process. We set up, funded a few years ago, East State Demonstration Project, added 10 states. Michigan now is one, and will be receiving full funding under an enhanced Medicaid funding and a prospective payment for services. And then we decided we wanted to reach out and start using grants, even though that's not the end, startup grants to help communities across the country be able to stand up these clinics with quality services. And under COVID, it became even more important when we've seen the incredible pressures on people and what is happening there. And so, in fact, when we look at things, prior to COVID, about 11% of the public said they were feeling anxiety or depression. And in January now it was 41%. And we're also seeing 1 out of 4 young people now reporting suicidal tendencies. We're seeing overdose deaths surge and so on. So in each of the pandemic packages, Senator Blunt and I put money in to set up startup grants for what we call CCBHCs, Certified Community Behavioral Health Centers. And now altogether, we have funding for 400 across the country. Over 41 states have at least one of the clinics. And in the meantime, in Michigan, I've been able to fund 24 clinics with $112 million so far for these important centers. So what does that really mean? I mean, we fundamentally want to change what it means to focus on mental health and substance abuse services. And here's what we know after the demonstration projects. It's really quite phenomenal. 63% fewer people in emergency room visits sitting there because of a behavioral health issue. 60% fewer people going to jail. 41% fewer people ending up as homeless. And so this works when you actually provide quality care in the community. What a surprise. So we are now moving forward, Senator Blunt and I, in the next couple of weeks to now take this nationwide to integrate quality care in the community. And this is something I feel passionately about. Second thing I feel passionately about in terms of gaps in service that have been amplified under COVID was the lack of school-based health centers. Back when we did the Affordable Care Act, I authored some dollars to deal with infrastructure construction for school-based health centers. It was actually snapped up very quickly because of the need, but there's not been ongoing federal funding for school-based health centers. And now in Michigan, again, we, I think, have real leadership in those who have been able to use Medicaid funds, not true across the country. Some places it's federally qualified health centers doing the work, but it's critical now, even more important now, that we're providing services for children in school, whether it's primary care, mental health care, whether it's focusing on nutrition education and health promotion and so on. So I've just introduced a bill, bipartisan bill with Senator Shelley Capito from West Virginia called Hallways to Healthcare. And we will provide funding through here to actually fund health center services. 200 million in new funding for comprehensive care, money for behavioral health, money for construction of new clinics, as well as a demonstration project on telehealth. So, I hear all the time now the concerns, of course, about children and what we need to do to support them in school-based health centers. And then the final thing I would say, because there's a lot of things I could talk about, but the final thing is telehealth. We just did a hearing in the Finance Committee not long ago about telehealth under COVID. We all know that everything as it relates to our virtual lives were magnified in every part of our lives in our economy. And certainly telehealth has become something that has really been depended on for essential healthcare. And in fact, we found recently that CMS reported a 2,700% increase in telehealth use for Medicaid and children's health insurance alone. And we know that nearly half of Medicare beneficiaries had at least one telehealth visit last year. So now the question, these policies are set to expire at the end of the public health emergency. I'm very focused on what we can do to maintain that flexibility and make permanent those opportunities and what that means for us in terms of reimbursement and so on. And frankly, we have to have high-speed internet. We have to have rural broadband if we're going to be able to really do this. So another hat of mine is focusing on how we make sure that access to high-speed internet is available wherever it needs to be, and certainly telehealth and how we move forward in a comprehensive way to make permanent telehealth services where appropriate, but make that tool available is something that I'm very focused on as well. And DJ, let me just close with this, and that is, that I love the Broadway play Hamilton, and there's a song in there called "The Room Where It Happens." So when it comes to telehealth, when we were writing the first CARES package, I was asked with a Republican colleague of mine, Senator Thune, senior members of the Finance Committee, to sit down and look at what changes needed to be made under Medicare and Medicaid and health centers and so on because of the pandemic. This is the very beginning. And we said telehealth and really weighed in specifically on telehealth. And I will never forget, as we laid out all the definitions, that mental health and substance abuse services weren't in there. Community mental health centers were not in there. And it wasn't because people were opposed, just they weren't thinking about it. It wasn't on their radar screen. And so when I pushed for that, they were included. And I realized how important it is to be in the room where it happens to make sure the definitions are right, and that that we are able to provide these services in the right way. So I can talk about a lot of things. I'm involved in lots of pieces of healthcare, but I'm going to throw it back to you, and happy to answer questions.
Yeah, well, I appreciate all that, particularly the focus on community mental health. I know we have a lot of folks in our audience at State of Reform from the community mental health system and centers. Let me ask you sort of kind of a political geek question for folks like me, at least. The sort of nature of a 50-50 Senate can obviously impact the work that your caucus can do. And I guess I'm wondering just what that is like and how this fits within the context of your career, where you continue to give voice as a sort of a mainstream thought leader in a lot of ways, but you got to hold the whole caucus of 50 together or you can't do anything. So just give us a sense of the challenge, just the logistical challenge of working in a 50-50 Senate.
Well, DJ, it is a challenge. I can tell you, I have served both in the state legislature and in Congress in the minority and in the majority. And the majority is a lot more fun. You can get a lot more done. It's certainly much more meaningful to be chairing a committee. But in a 50-50 Senate, I mean, every day is a challenge because people have different ideas and beliefs and priorities and so on. As a person involved in public service, I work across the aisle every day. That has been what I've done all my life. That's why I'm able to get things done. And that's the most important thing, is to be able to get things done. But right now it is a particular challenge because there are just different views on healthcare between 50 and 50 and even within our 50 and different views on the economy, different views on tax policy, on how to address the climate crisis. Is there a climate crisis? So it is very challenging to be able to move forward. I think it's honestly amazing that we've been able to get done what we've gotten done in just 150 days or something. I don't even know how much. Given all of the challenges coming at us in every way, I am thrilled that Joe Biden is president of the United States and Kamala Harris is vice president. And their heart and soul is in my judgment, the right place and what we need to do, certainly for Michigan. And but it's every day, we have to figure out how to move forward, and it would be easier, if we weren't in a situation that was 50-50.
So you talked about having already gotten a lot of stuff done. The American Rescue Plan Act is a big deal, I think, in a lot of ways, particularly for healthcare. That happened through this budget reconciliation process, another process that only geeks perhaps like me might be interested in. But one of the questions and topics is related to the filibuster. Your colleague from Oregon, Senator Jeff Merkley, makes a really compelling argument, I think, where he says that the filibuster only applies to Democratic priorities like expanding coverage. It does not apply, in his view, expanding coverage to healthcare services. It does not apply, in his view, to Republican priorities like tax cuts or judicial appointments. What are your thoughts on whether the filibuster needs reform and to what extent it might be reformed?
Well, DJ, it absolutely needs to be reformed, and in my judgment has been incredibly abused over recent years. I mean, when you look at the few times it was ever used in the first 100 years, 150 years, or 180 years of our country versus what's happening now. I mean, it's clearly used for a minority to be able to just obstruct, and that's not why it was set up in the beginning. Again, back to Hamilton with my geek hat on, actually going back with all this debate now. I've been reading the Federalist Papers about all the debates about having a majority government. They came from a king. They came, from a place where the majority of people did not decide what was going to happen for themselves and families in the country. And they said majority. They didn't say a small minority or a big minority. They talked about everyone having their say and then having a majority vote. And so I really believe that that's what needs to happen in our country. And I think in the end, most people kind of scratch their heads at all of this when we talk about budget reconciliation or whatever. They just say, don't give me all that political gobbledygook. Just tell me, is my life going to get better? Just tell me, am I going to be able to have a good paying job and affordable health care and be able to afford to pay for my medicine? And by the way, am I going to be able to get high-speed internet? So if something, if my kids are continuing to be home virtually from school, that they're not going to be disadvantaged if they're up in the Upper Peninsula of Michigan, as opposed to some other place that has high-speed internet. So what people want right now is results, not a bunch of excuses. And I think some of the filibuster debate now falls in the category of just excuses. It is not productive anymore. So we should say majority and each take responsibility for our own vote.
One of the areas, at least until the filibuster is removed or reformed, one of the areas it feels like there could be some action in through a budget reconciliation process would be on the topic of Medicare eligibility. You're on your Senate Finance Committee, a senior member. Medicare is in Senate Finance in terms of its jurisdiction. What are your thoughts on moving Medicare eligibility or the age of eligibility from 65 down to 60 or 55 as part of a set of reforms this year?
Well, I would love to see some kind of expansion. I know there are issues, particularly for our hospitals and other providers about payment rates and so on that come into play that would have to be worked through on that. I mean, I think if, I have put forward a bill that would basically be a public option for folks starting at age 50, where they could buy in. It'd be a separate fund, and you could use your Affordable Care Act tax credits and so on, and Medicare Advantage would apply and so on. So, but something like that, I certainly would support, or something, or moving the age down to 60 within the current system. I realize there are issues that have to be worked out, and I'm very thoughtful about that. Certainly want to work with folks on that, but I am supportive of something there. I also think that we should be updating Medicare for dental and vision and hearing. I mean, if we really want to have another impact in a positive way, I hear all the time from folks about those issues, which we could do, and I believe that we should do. I think that would be a very positive change as well. So I'm all for making sure that we have high quality and affordable health care, and structure it in a way that makes sense.
You mentioned a public option in your legislation for a buy-in to Medicare. I'm wondering if you could sort of give us a sense of how the Democratic conference in the Senate is thinking about the future of health reform, between the one vision, I would say, on the one end of Senator Sanders, who's arguing for a much more perhaps revolutionary vision, and then someone like Speaker Pelosi, who argues that Democrats should build on the Affordable Care Act and extend that. Give us a sense of where you sort of land in between those two poles, and where you think that conversation is going to play out in the Senate Democratic Conference.
I think it's really important to move forward and to have progress on, again, quality, affordable healthcare for people. And President Biden has made it clear he's not a Medicare for All supporter. There are differences of opinion, certainly in our caucus. We all support providing healthcare, though, which is a very big, I just have to say, very big difference from my colleagues on the other side of the aisle who wanted to repeal the Affordable Care Act completely. and would like to privatize Medicare and so on. So we have a very different view in terms of wanting, we all are committed to healthcare as a right, not a privilege in our country. We have different views on how you proceed in terms of making that happen. And so I fall in the category of wanting to certainly strengthen the Affordable Care Act. I don't think that's enough. I mean, I think we need to strengthen it, and then we need to look for opportunities to be able to expand healthcare for people, and whether that's a public option, whether that's lowering the age of Medicare, whether that's providing essential services like dental and vision and hearing, which I think are so critical, that we need to, at this point, just find a way to provide a step forward. So I'm interested in actually making progress, and will support efforts to do that.
Give us a sense of how this public option conversation is kind of playing out. It feels like the public option as a brand or as a concept has a lot of interest, but a lot of different maybe definitions. There's not one clear definition. Do you think that, I believe the president was hoping to have some sort of public option conversation in the sort of summertime or in a second kind of reconciliation package related to healthcare. Do you see a public option conversation coming to the floor in a formal way in the Senate?
It's not clear. I have colleagues that are working hard on developing something. Again, there's different ideas. There's so much to do in so many areas. And by the way, we're not done with COVID, right? And so, in terms of healthcare, number one is making sure people are vaccinated and make sure that vaccines are developed for children, making sure that people get safely back to work and school and so on. So that is still, primary focus. But the other pieces, there will be a lot of discussion on. It's not clear at this point where we go in terms of how much would be done in a second reconciliation. There's so many things that need to happen around, and certainly, I support, again, moving forward. My guess is it will not be, I don't think it will be dramatic. I think it will be about moving things forward to be able to support people that have high quality healthcare, more healthcare. I certainly want to move forward and include our behavioral health clinics and get those across the country, get those nationwide. There's broad support on that. I want to see us doing more, to provide healthcare for people. So I think probably that is not a dramatic reform at this point in time. It's probably more incremental steps. And when you step back and look at traditional infrastructure, family infrastructure, what the president has talked about in his family plan, which is absolutely critical, by the way, as you know, home care, home and community-based care, child care. When we look at whose jobs have been lost in this pandemic, the majority have been jobs held by women. When we look at all the impacts on women, and issues like childcare, when we talk about infrastructure, certainly moms and dads, but when you just ask a working mom if childcare is part of her personal infrastructure, and she will say yes. And so we just have multiple things right now that we have to address as we come back out of this pandemic into hopefully a place that will be better in the economy for people. It's not just going back to the way things were. I hope we're going forward to a better quality of life and better support for families. And certainly the child tax credit that we put in place for this year, the capacity to lift half of the children in this country out of poverty this year, I'm pretty excited about that. Could we put in place things that would do even more for families, including healthcare? Yes, we can.
We can, but there's a lot of other great stuff on the agenda right now before the U.S. Senate, and of course, the entire federal administration. So good to remind us about the infrastructure plan and the family plan. That's good stuff. I know we're getting close to the end of time, and you've been very gracious. Thank you for all of the just time you've given us. I want to ask just what gives you hope about the rest of 2021, we are still in a pandemic. Our politics feels like they are settling down, but January 6th and the election were not that long ago in our collective memories. So what gives you hope as you look out on the rest of 2021 and our American Republican democracy?
Well, DJ, there's no question we've got challenges. We certainly, January 6th was not that long ago, and certainly we're still in the pandemic and so on. And I don't dismiss those things. They're real. Things are serious, but I am very hopeful. I focus on what can we do? What can we do to be able to use all of our talents and strengths? The majority of the people in this country just want to care for their families and, have a good life and the healthcare that they need and all the other things for their family, and enjoy the Great Lakes and all the beauty of Michigan. And we just have got to figure out how to move forward. I'm very hopeful because of this president and this vice president, who have an administration that is talented and competent and caring. The conversations we have are certainly dramatically different than the conversations I've had in the last 4 years. And so that gives me great hope. Also, the fact that we have been able, even in a 50-50 Senate, to be able to do a lot in a very short amount of time. The American Rescue Plan was a major investment in where we go on the pandemic and healthcare. Where do we go on supporting small businesses and families to survive this, and our family farms? Or where do we go on education and all the other things? And it was done, in a challenging situation, and people stepped up. People are committed. They want to move forward. I really do believe this is a moment for boldness, and we need to seize the moment together, as not think little, but we need to think big about our country and seize our international leadership again in a positive way, and be bold about what we need to move forward. So I'm excited about the possibility for that. It's not easy every day. I can tell you it is not easy. But every day I see people that are suiting up and saying, okay, this is an exciting moment. And let's go see how much we can get done, so that at the end of this, we're not just saying you got your old life back, but you got a better life and more opportunity and a stronger country. And so I'm focused on that.
U.S. Senator Debbie Stabenow, the 4-term senator from the great state of Michigan and member, of course, of the Senate Finance Committee. Thank you for your doggedness and your grace, and for all of the time with us. So we appreciate it.
My pleasure.